do the 10 minutes.
And do the introduction. You've got to carry on as if like normal now, so I have to work out what's going on.
Okay. Hi there, my name is Dr. Debbie Wake. I'm a diabetes specialist consultant in the NHS in Edinburgh, and I'm an academic with the University of Edinburgh. I'm also CEO and clinical lead for My Way Digital Health, and we've been supporting the running of the Understanding Type 1 online course that's been running today and tomorrow. So first of all, I just wanted to say hello and welcome, and thank you for those of you who've joined us on the course today. It's been great to see your comments and your feedback, and we've really enjoyed sharing the stories with you around how you've been managing your type 1 diabetes, and I think others on the course have really benefited from that sharing and learning experience as well. So I just wanted to tell you a little bit about how this was going to work tonight. So we're going to be live for an hour to answer your questions. To put a question to us, what we'd like you to do if you're on Facebook is to just use the comment section below this video. And if you can just post your questions into that comment section, we'll keep an eye on that. And as the questions come in, we'll try to answer them. The other way to answer questions is to use Twitter. So if you can use the #Understanding Type 1 hashtag. So I'll say that again, that's #Understanding Type 1. And if you put that into any Twitter messages, then again, we will pick those up. So any questions can either come in through Twitter using the hashtag or through Facebook using the comment section underneath this video. So before we get started today, just as we wait for your questions to come through, I'd like to tell you a little bit about the course and how it's running and why we're doing this really. So My Way Digital Health is a spin-out company from the University of Dundee, and we've been running this course along with support from NHS England. So earlier in the year, after lockdown kicked in, we were asked by NHS England to set up a national type 1 diabetes platform for anyone in NHS England with type 1 diabetes. And so that's now been running since June and is available to anyone around the globe, can really go in and use the website. For the structured education courses on the platform, you need to be registered in NHS England, but that website is www.type1diabetes, sorry, I'll say that again, www.mytype1diabetes.nhs.uk. So that's www.mytype1diabetes.nhs.uk. So we advise people to go to that website for any more information, educational resources that they need, and you can click into other structured education courses. And we've now got 5 additional structured education courses there available to people with type 1 diabetes, and these are courses on carbohydrate counting, which we touched on a little bit today, but that's a much more in-depth course. We've got 2 courses that relate to insulin pumps, one for people thinking about starting insulin pumps and one for people who've actually started insulin pumps. And we've also got a course called Living with and Growing Up with Type 1 Diabetes, and that covers things like travel and employment and exercise, but there's also some sections in that are very specific for young adults with type 1 diabetes, covering things like leaving home, alcohol, university, employment, sex, music festivals, tattoos, body piercing, all that sort of stuff. So more information there about that. The other course we've got on that site is our standard type 1 diabetes course that we would recommend as a sort of comprehensive course for anyone who's been newly diagnosed with type 1 diabetes, and that really goes through everything, but in a bit more detail than what we've got time for in our 2-day online course that we're running at the moment. So today and tomorrow's course is really meant to be a bit of an introduction to you, to give you some taster, some feedback. For some people who've had type 1 diabetes for a long time, it's hopefully just been a bit of a refresher. But these other courses are a way of really getting more detailed information on those topics. So if you live in NHS England, that's the website to go to. If you live in one of the following regions though, you also have a regional website, and we would actually encourage that you use your regional website rather than a national website because it has some additional advantages. It allows you to also register to access your electronic health record online, so that way you can see all your data coming through, and it will give you automated personalised feedback on your data as well as accessing the resources. And it's also got a lot of local content for you, pointing you in the direction of your local services, phone numbers, email addresses, and other local face-to-face educational opportunities. So if you live in Manchester, Greater Manchester area rather, Lancashire, South Cumbria, Cheshire and Merseyside, Halton and Warrington, Somerset, North West London or North East London, you actually have a regional website that you can go to that is run by My Way Digital Health, completely free of charge for anyone who lives in those regions with either type 1 or type 2 diabetes, to be able to access the educational information and also access their electronic health record online. So we'll put more information into the Facebook feed about that so that you can click through to the different regions. The other bit is, of course, Scotland, which is where we've come from. And actually, the My Diabetes My Way platform has been running in Scotland for almost 13 years now. So if you live in Scotland, basically go to My Diabetes My Way. And again, you'll be able to access all the e-learning courses that I talked about, access your electronic health record online. And in fact, a third of all people in Scotland with type 1 diabetes already use this service. So it's been well used with good feedback from those who are already using it. So that was just a little bit on what is out there for you. So getting back to today's course. So again, thanks for people who joined us on the course today. It was really great to hear from you. Just picking up on a few comments and feedback from the course. One of the sections that got a lot of discussion was around glucose targets, and I thought it's worth just spending a little bit of time just talking about this in a little bit more detail. So in terms of glucose targets, I think there's a bit of confusion. We'd put some glucose targets in that are sort of recommended by national bodies of ranging between about a 4 to 7 before meals, which is generally seen as a good range. Some of you mentioned that you're using the Libre system and that you'll generally be aiming for maybe between a 4 and a 10. And I think there's a slight difference between what we'd call time in range, which is when you're using these glucose sensors and Libre readings, which give you readings throughout the whole day. And what you're trying to do is keep yourself between certain parameters. And these very specific targets that we recommend pre-meals. Now, your pre-meal target is essentially a fasting blood glucose, so it will be one of your lowest blood glucose of the day, and 4 to 7 is generally recommended as a target for that. Before bed, people often say maybe a 5 to 8, running a slightly higher blood sugar level before bed is good, as people will tend to fall, their glucose levels will tend to fall a little bit overnight. Some of you said you felt a little bit daunted by some of those targets, which is fine, is perfectly understandable. I think it's important that everybody in discussion with their healthcare teams have their own personalised targets for blood glucose levels, and that you work with your healthcare team to achieve those. And it may be that if these national guideline targets seem a bit daunting at the moment, we would recommend you set an interim target in the meantime. Work towards that interim target. Once you've got there with that target, you can maybe start moving closer towards the national targets. But it is something that you need to personalise. Those targets have really been set based on research that tells us if we can get people closer to those targets, your risk of long-term complications is significantly reduced. So that's why those targets have been set. Now, I've just seen a question that's come through from somebody. Let me just have a look at that. Is there any particular time that I should be taking a ketone reading, e.g. when my reading is high, or should I be taking it daily? Really good question. So we talked a lot about glucose targets, and we talked a little bit about complications like ketoacidosis. So what we would generally recommend for ketone testing is, and there are various guidelines, so whatever I say here, there will be a healthcare professional saying that's not exactly what I use in my practice, but as a rough guide, we would say if your blood glucose level is over 14 on 2 occasions, then you should check a ketone level. The other time when you should be checking ketone levels more regularly is if you're unwell. So generally, we'd say, you don't need to be checking a ketone level every day. It's only something that you should do if you've got high glucose levels that aren't settling down. So 2 14s in a row over a short period of time, I would generally check a ketone level. Otherwise, most of the time, you don't need to be doing it. If you're unwell, you've got a significant illness, it probably is worth checking ketones every day, even if your blood sugar levels are okay. Because during illness, it's very easy to become insulin deficient. Your body requires a lot more insulin to work properly during illness. And so at that time, we would suggest check your ketones a bit more often. If the ketone levels are creeping up high, then there is a protocol you can use to try to titrate your insulin to bring the ketone levels down, to drink more fluids. And there's also guidelines around a level at which it's important that you seek medical attention. Now, we'll cover more of this in the sessions that are coming, and actually we've got some really nice sick day rules that, as a flowchart, that tell you exactly what to do in terms of when your ketone level reaches a certain level. So what I'll maybe try to do, we're going to have a break. The way we're going to run this session is we're going to have 10 minutes of me chatting. Then we're then going to have a 5-minute break where I'll go away and look at the questions that are coming in, and then I'll come back again for 10 minutes, and we'll do that 4 times throughout the hour. So what I'll do in the next session is I'll see if we can just bring up a bit of information, or I'll point you in the Facebook chat to where you can get those sick day rules, which are really explicit around exactly when you should and shouldn't be checking ketone levels. So I'll leave you with that. We'll put more information in the chat about that. I'm going to stop there for a minute, and we're going to just go offline for a couple of minutes to have a look at the questions that are coming in, and we'll pick things up again after that. So please send your questions in either on the Facebook chat below the video or through Twitter using hashtag #UnderstandingType1, and I'll speak to you again soon. Thanks. Hi again. So thanks again for joining us. So for those who weren't here at the start, I'm Debbie Wake, diabetes consultant and clinical lead and CEO of MyWay Digital Health. So we're just answering your questions today off the back of the Understanding Type 1 online course that's been running today. So thanks again for people who've been engaging with that. A couple of questions coming through on the on Twitter and on Facebook at the moment. So somebody was asking about the carb counting courses. So I think in the course we mentioned that there's a much more detailed carb counting course available, and there was a link through to that. Somebody said that link isn't working. So what I've done is I've posted in Facebook chat there the link to the Type 1 diabetes platform, the NHS England Type 1 diabetes platform, and what you need to do is just click into the e-learning courses, and then you should be able to go from there into the carbohydrate counting course. You will need to set up a new registration, unfortunately, because it's a different platform, but hopefully that'll just take a minute or two to do. So if you're in NHS England, that's the way to do it. What I've also done is posted in Facebook there's some links through to the other regional sites. So if you live in any of these regions, those are the platforms to go to, and you can get more information about type 1, and you can link through to these other courses that are there, the other structured education courses there on carb counting, understanding type 1, living with type 1 diabetes, thinking about insulin pumps, and the insulin pump start course. So those are all there. So I would use those links. If you've got any problems with that, do of course just get in touch with MyWay Digital Health, info@mywaydigitalhealth.co.uk. So moving on from that, we will post some more information in the feed about the sick day rules, which somebody asked about in the last session. We're just trying to get that up, so we'll send you a link through to that, and that tells you a little bit more about ketone monitoring and when to do it. So that's coming. There's been a couple of questions about exercise regime. So I've got two questions here about exercise regime. I'll just take the first one, which says my exercise regime isn't stable, even though I'm doing the same exercise for the same length of time and starting blood glucose levels very similar, with basal rates are moving between 60 and 80%. So how do you work these things out other than good monitoring before and after? So exercise is something we'll cover a little bit in the course tomorrow, so you will get a little bit more on that. What I'd say is we've got much more detailed information on exercise in some of the other online courses that I've talked about. So if you don't get enough out of tomorrow's course, please go through to some of the other sites. Exercise is really tricky. Insulin pumps should make exercise easier. So in general principles, when we're thinking about exercise, you need to think about the length of the exercise and the intensity of the exercise. And it sounds like you've already done that, but just for people who maybe aren't aware of this, so the length of the exercise will dictate the impact on blood sugar levels, as will the intensity. Obviously, the much more intense exercise, you will tend to use up energy much quicker. But also, and this might be why you're getting some fluctuations in your glucose levels, are what we sometimes find is that if you're doing high impact exercise, really rapid exercise like sprinting, or exercise like football, or when you're doing game sports, tennis or whatever, where you're doing short, sharp sprinting and then you're slowing down for periods, actually what can happen during those short, sharp bits of strenuous exercise, actually blood sugar levels can rise, and that's just due to a stress effect on the body. Whereas slower, more lower intensity maintained exercise will tend to just cause a gradual decline in blood glucose levels. So sometimes people use this to their advantage, in that if sugar levels are running a bit low, you can actually do some fast exercise and sprinting to push the levels up. But if you're doing slower, sort of sustained exercise, you either need to have extra glucose on board for that, or you need to reduce your insulin dose before exercise. So that might be a lower insulin dose at the meal time before you've exercised. Or if you've got an insulin pump, as we heard from this person who's asked a question, sorry, I don't have your name on the message that's been sent through to me, you might want to just lower your basal rate. And one of the advantages of pumps is because it's just giving rapid acting insulin all the time, you don't have to plan so much around exercise. So when you're about to start exercise, you drop the rate, your pump's giving you insulin. That should help with things. But it may be if you're finding that your insulin requirements are different during different exercises, it may just be because of this difference between, as I say, more sort of fast-paced, strenuous exercise and lower sustained exercise. So without knowing exactly what exercise you're doing, I can't give you much more on that, but maybe that's helpful. The other thing to think about is just about how much carb you've got on board at the start as well. You know, is there anything that's been different about your what you've been doing earlier in the day in terms of, is there any lag over from any previous exercise? Because your metabolic rate does tend to stay high for about 24 hours after exercising. So if you're kind of stacking up exercise, it may be that your metabolic rate's already a little bit high, or it may be that maybe something you've eaten earlier in the day has meant that you've got more sustained carbohydrate on board, more glucose stores. So there are a number of different things. I'm not sure if that answers your question, but it's maybe given some pointers and hopefully helped other people who are thinking about exercise. We will talk more about exercise tomorrow, but as I say, there are some really good detailed exercise information on some of our more detailed courses as well, and that helps you work through these things. At the end of the day, sometimes it is a bit of trial and error, so you may need to do that. I've got another message here saying, okay, so I've got another one. I exercise every day. My problem is that after a long swim or a 4-mile daily walk, I feel really hungry. It's a vicious circle, as with all the fresh air and exercise, especially at this time of year, I feel the need to eat comfort food, which doesn't help my condition anyway around this, finding it difficult to stick to salads. Okay, yeah, no, thanks for that, thanks for sharing that. So I think, again, it comes back to, it depends whether you're using an insulin pump or injections to manage your insulin, but I think a lot of people struggle with exercise in that they find after exercising, if they're doing sort of slower sustained exercise, sugar levels are dropping, and then they have to eat to try and keep the blood sugar levels up, which can be really annoying if you're trying to lose weight or if you're trying to keep your carbohydrate intake down or your glucose level down. Then having to eat to avoid a hypo because you're exercising just seems like a bit of a vicious circle, as you see. So what we would generally say to people is, if you can preempt this to any extent, the better. So if you know you're going to be going out for a walk and you can actually reduce your insulin dose, let's say at lunchtime if you're going out for an afternoon walk, and the amount you reduce your insulin down by might be by 25%, 50%, 75%, or even 100%, depending on the length of exercise you're doing and how strenuous the exercise is. So again, we've got a table that we can direct you to that kind of which you work those things out. But intuitively, if it's a short, not very intense exercise, you might do a 25% dose reduction. If you're going out to, you know, to run for 2 hours solid at high pace, then you're probably not going to want to take any insulin at lunchtime. But you do want to have some background insulin on board. So what's really important is that you don't do exercise without background insulin on board, because if you don't have background insulin on board, the glucose can't get into the blood, can't get into the muscles. So it will sit in the bloodstream. It won't be dispersed into the muscles, which is essentially what glucose does. It disperses glucose into the tissues that need it, and you'll find you're just not able to exercise. Those muscles aren't getting the energy that they need. So you do need insulin on board while you're exercising. That's really important. But you'll get most of that from your background insulin, and what you might want to do is adjust your fast-acting insulin before exercise to reduce your need to take extra carbohydrate on board. But it is a bit of trial and error, and different people find different things work. So that's helpful. I'm just looking at another message coming through. Sharon, thanks for sharing. You've sent a message saying to David, "Hi David, I get on really well with the Carbs and Cals books that are available. Covers most food types and also portion size is well worth a look. Good luck." Yeah, good tip there, Sharon. Thanks for sharing that. We throughout our courses, you might have noticed we use quite a lot of the Carbs and Cals images. So people who aren't familiar with Carbs and Cals, they have a smartphone app. And they also have a book. So it's a really good way if you're getting used to carbohydrate counting. And they let us really use a lot of their images. And so what the book does is it has different foods with different portion sizes on it. So you can very visually just glance at something and say, you know, there's a plate of rice, or there's a plate of spaghetti bolognese. And yep, that picture looks roughly like the portion size I'm about to sit down and eat. And it will just very quickly tell you what the carb content is of that, so you can use that for your calculating your insulin carb ratios and your insulin at meal times. So that's very good. The app's very good. Diabetes UK has also got some carbohydrate tables that you can use as a lookup for different foodstuffs in terms of trying to find out what what the different carb content of different foods is. Obviously food labels are good. Certain restaurants, if you're going to them in advance, we did have some comments on the course today about people finding it really tricky when they're eating out. I think counting carbs is easy-ish if when you're in your own house and you can look at food labels and you can weigh stuff, but it's hard when you're eating out, and I think that's absolutely true. I think saying that, some of the bigger chains are quite good at publicising their meals and the carb contents in their meals. So, you know, you may want to look at choosing restaurants that do that if you want to get a little bit more accuracy around your carb intake. But I agree, eating out is hard, particularly when you often don't know what your food's going to look like till it arrives in front of you, and then you've got to do some rough measurements. So yep, so that's just some information about the carb counting. If anyone else has any tips on what they use for carb counting, then again, let us know. Feel free to share it with other people. I also posted on the course today some little videos that have been produced by a team in Leicester, which are brilliant. They talk about handy measures, and they have a dietitian showing you how to kind of weigh out food and have handy measures so that you, for example, you always know that a cup of pasta is X amount of carbohydrates, and it means you're not having to work it out every single time you do it. You just know, right, that's my favourite pasta, a cup of that, I know what that is, and that goes in, and that's my portion size. And you can do that with cereals, with rice, with things like pasta, stuff that you might use all the time in your kitchen, and you have those marked. You know, you could even have a jar marked, so it says 20 grams of carbohydrate to here if it's rice, 40 grams of carbohydrate to here if it's cornflakes, for example, and then you just use that as a scoop in your kitchen. So little tips like that I think can sometimes make the carb counting a little bit easier. So I'll post some of those videos. Comment from Ellie saying a table would be really helpful, as my husband, who is type 1, likes to run in the morning, but it can affect his levels later in the day. Yeah, okay. What we'll try to do is get, try and put some stuff in the links below when we're having our break, which will take you through to different resources. I say there will be more tomorrow on exercise, but yeah, essentially an easy table is to think, there is an easy table which just talks about insulin reduction, and this is talking about reducing your insulin dose in the meal prior to exercising, and it will tell you whether to reduce it by 25, 50, 75% or completely get rid of it, depending on the length of exercise and the intensity. So I'll try and find that and post it for you. If I don't manage to get that into the chat tonight, I will certainly make sure it goes into the information tomorrow on the course. So that's great. Good. I think we'll take a break there, and just we'll come back to you in about 5 or so minutes. In the meantime, keep your questions coming. It's great to see them all, and we'll try to, as I say, upload some information into the chat while we're offline. Okay, thanks. Speak to you soon. Hi there, thanks for joining us again. So Debbie Wake here, diabetes consultant, CEO of My Way Digital Health, if you've not been on the Q&A up to now. So just to let you know what we're just doing some we're doing 4 Q&A set, 4 10-minute Q&As throughout the course of the hour. So this is the third of the fourth. We'll go live at the moment for 10 minutes to answer some questions. We'll then have a 5-minute break to have a look and recap on the questions, and then we'll go live again for the last Q&A at about 5:45. And we'll wind up at about 6 o'clock. So yeah, thanks for sending stuff in. We're just trying to get more information up on the Facebook stream for some of the questions that we had earlier. Just for those who didn't join us earlier, just for awareness, you can still join the Understanding Type 1 diabetes online course. So if you know anybody who maybe didn't manage to get registered for today, we will keep that content open for a day or two, and people can still join in and do the content even a day late. So we will be opening up more content tomorrow, which will be starting to look at things like complications of diabetes and living with diabetes, and some of the other targets in terms of sort of longer term targets for achieving good long-term health when you're living with type 1 diabetes. So hopefully that'll be interesting. Just to mention as well, this is also being supported by NHS England. So we've got the NHS England website we've put into the Facebook feed. But for those of you maybe not watching it on Facebook, www.type1diabetes.nhs.net is where you can go for more information, more courses. So these 2 days is meant to be just a bit of a taster really, but that'll give you much more in-depth information on some of the stuff that we've been talking about, like insulin pumps, carb counting, living with diabetes and so on. And just wanted to say thanks as well for the University of Dundee and the University of Edinburgh, who are also supporting these courses. In Scotland we run My Diabetes My Way through the University of Dundee, and the University of Edinburgh has also been supporting some academic aspects of this. So thanks to those partners as well. So getting back to some of your questions, there was some questions about Libras. So the Libre system, as many of you will be familiar with, is now a new way of monitoring blood sugar levels for people with type 1 diabetes. It involves a sensor that's usually placed on the arm and a scanner, which you can either use a scanner or you can use your mobile phone as a scanner to basically scan over it, and it will give you a blood sugar reading. It will collect blood sugar readings every 5 minutes, and when you look at the readouts, you can actually look at a sort of almost a continuous trace of your blood sugar level throughout the day and throughout the night. Obviously it doesn't involve any finger pricks. The sensor does need to be replaced intermittently. But there's a lot of people been feeding back on the course about the usefulness of the Libre, and I think that's generally been the feedback from people that I know with type 1 diabetes. And it was just really to clarify some of the rules around the Libre. So Libras should be available now to everyone with type 1 diabetes in the UK, and the NHS England have really been strongly pushing this. So if you're living in an area and you're interested in getting access to the Libre technology, you have type 1 diabetes, then please speak to your healthcare team about that. And if you're struggling with that, I would get in touch with some of your specialist team or even some of the national team, because you will be strongly supported in getting a Libre, as they should be available nationally for everyone with type 1 diabetes. Most people have found it incredibly liberating in that you're not having to do so many finger prick tests. It gives much more detail on a 5-minute by 5-minute basis on what the blood sugar level is. But some of the questions were coming in about the accuracy of the Libre. Libre is great at looking at trends. So if you're looking at whether your blood sugar levels are rising or falling, if you're heading towards a hypo, if you're heading towards a high blood sugar level, it's brilliant because it will plot that trend over time, and it means you can intervene quickly and avoid a significantly high or low blood sugar event. In terms of an individual blood glucose reading, it will not be quite as accurate as a finger prick reading. And there will be times when your Libre reading might be at odds with what you're finding with finger prick readings. That's partly because the Libre, there is always a lag. It's measuring interstitial glucose, not measuring capillary or blood glucose. So it takes a bit of time for the glucose level in the blood to then be distributed out into the interstitial, this sort of fluid underneath the skin. So there's always a little bit of a lag. So the Libre will lag a number of minutes behind a blood glucose reading. So if your blood sugar is rapidly changing, your Libre might say you're at a 7, whereas actually your blood glucose level, if you're dipping fast, might be at a 4 or a 3 or something. So I think if you ever feel hypo or feel unwell and you think your Libre reading is giving you the wrong reading, always check with a finger prick test, and always also go on your symptoms. So if you're feeling like you're hypo, trust that, treat your hypo, but ideally if you've got your blood glucose meter with you, check a glucose meter in that setting. So that hopefully helps people understand a little bit more about the difference in terms of the accuracy of the Libre. Some other feedback we had was that people were saying that they'd maybe tried the Libre, but because it wasn't able to tell them when they were running high or running low, there was no alerts or alarms on the system, let's say, they didn't find it as useful. Just to say, there are other continuous glucose monitoring systems out there, including systems produced by Dexcom and so on. They tend to be much more expensive, but what they do is they give alerts for when your blood sugar is running high and low. And for people who are particularly susceptible to hypoglycemia, low sugar events, it may be justified to have one of these if you're somebody who's had a number of episodes of severe hypoglycemia. Generally, these continuous glucose monitoring systems aren't funded on the NHS, except in exceptional circumstances. But I did just want to mention that there is a Libre 2 coming out. So this is going to be a new upgrade to the Libre system, and it's expected this will have some high and low alerts on it. So that sort of additional functionality that people have been looking for, I think, will be there within the Libre 2 system. That's only just being launched in the UK, so I think we're waiting to see how quickly that's going to be diffused across the service and whether we will be replacing Libres with Libre 2s. But I expect for people who have particular problems with being susceptible to low blood sugar events, then the Libre 2 may be a useful update for you, so just for awareness around that. The other thing I wanted to talk a little bit about was pumps, because we've been getting some good feedback from people around insulin pumps. A lot of people who maybe aren't using insulin pumps at the moment, who've got a little bit of information from the course about insulin pumps and are really quite excited and interested to try insulin pumps. So I guess what I would say is that insulin pumps are not a easy option. I think a lot of people think you plug in an insulin pump and it will do all the hard work for you. And insulin pumps at the moment will not calculate your insulin dose. So what you can do is program them to run a certain background rate of insulin, and throughout the day you can program them so that your background rate is slightly different in the morning compared with the afternoon, compared with overnight, and that can be all pre-programmed based on your normal body's physiology and what you do. But you still need to count your carbs, and you still need to tell the device, the pump, how much carb you're eating, and to tell it how much insulin to give at meal times, for example, as a bolus dose. So it can't intuitively know things like eating and carb content of foods and things. So that bit of work still needs to be done there, but it does. Some people do find it very useful, and as we talked in the last session about exercise, one of I think the big advantage of an insulin pump is that you can just put a temporary basal rate on when you're exercising, which means you don't have to plan so much ahead in terms of adjusting your insulin doses before exercising and so on. You can just put a temporary basal rate on so that your insulin rate runs at a slightly different level during exercise, and then pop it back up again. Similarly, if you're out and about, you're being more active of an evening, if you're drinking alcohol, if there's other things that are likely to impact on your insulin levels, again, you can set temporary basal rates. So that I think that's one of the advantages. There are now systems coming into the market that you'll be aware of called closed loop systems, and these will, I think, ultimately provide almost a bionic system whereby the glucose readings will come in from the glucose sensors, will send information to the insulin pumps will do the maths and sort of almost automatically correct insulin doses. These closed loop systems, there are now some on the market, again not available at the moment on the NHS except in exceptional circumstances, but there are a lot of people who are using technology themselves to develop their own home glucose closed loop systems. So there is a lot of type 1 diabetes patient groups out there, including the Night Owl project, which again we can send you more information about. But usually if you're going to embark on this, a lot of the people who set this up come from an engineering background, and it does require a bit of sort of programming skills and things if you're going to try and set up your own closed loop system and join up an insulin pump to a glucose sensor. So I think not for the faint-hearted, but I say there are groups out there who are doing that and getting successful results by developing their own at-home closed loop systems. So That's the sort of We Are Not Waiting, or the Night Owl, the Night Scout project. So we can as I say, tell you more information about that if you're interested. There is another question come in asking, what do you think about calculating exchanges? I found it more difficult than carbs, although in my country it's very popular. So that's come in from Dominica. Yeah, interesting. So when we talk about carb counting, there is there's different schools of thoughts on this. So we talk about insulin carb ratios, where we're talking about units of insulin to grams of carbohydrate. So you might have 1 unit of insulin that you take for every, let's say, 10 grams of carbohydrate, if your ratio was 1 to 10. But there are certain educational programs, and I know in some other countries they talk about carb portions. So Daphne talks about carb portions, like a carb portion being 10 grams of carbohydrate. We do try to, in some of our other courses, make it easy for people to understand what grams are in carb portions. So if you've been trained using Daphne, then it's easy for you to then think about things in insulin carb ratios in terms of grams and units. We think grams and units are easier, and when people progress onto insulin pumps as well, it kind of is just easier. Carb exchanges, we don't tend to teach people much about that now. I think it was something that a lot of people were taught about in the past, was about sort of exchanges, but as I say, it isn't something. It'll be interesting to hear from Lynn and Salma and some of the others on our team about whether they would still ever work in carb exchanges, but it's not something that certainly we use very much. So we can maybe post something on the Facebook chat about that. And I just wanted to say, and it's very remiss of me actually up till now to talk about the team who are behind this. So I'm here as a diabetes consultant, sort of being the face of the team, but actually we've got a fantastic team in the background. Kirsten, who's our learning resource officer, David, who's our partnership director and also has type 1 diabetes, Alex Bickerton, who's a consultant based in Somerset, Scott McKenzie, who's a junior doctor. We've got Lynn Wilson, who's a diabetes specialist nurse. We've got Salma Meher, who's a dietitian based in northwest London, and she does a lot of work with the Black and ethnic minority community and has helped produce the World Carbs and Cals book, which she's talked a bit about on the Facebook stream. So that's a fantastic resource for people from ethnic minority groups to be able to calculate carbs using local sort of diet pictures and options. And also Dr. Nader Lesson, who's based out in the Imperial College Diabetes Centre out in Abu Dhabi. So we've got a fantastic group of people who are the faculty behind this course, and they're all out there and sending things through on Facebook and on our WhatsApp group and answering messages and answering the Twitter stream, and throughout the course as well have been contributing comments. So thanks to everyone for that. And diabetes is a truly multidisciplinary specialty. We rely very much on our educators, our nurses, our dietitians and the whole team in supporting that. So we're going to just go offline again for just a couple of minutes to look at some of your other questions that have come through, and then we'll come back on again for the last Q&A session. So thanks everyone for your input, and thanks for the team who are supporting it. Hi again, welcome back everybody. So this is the final session in our Q&A for the Understanding Type 1 online course that's running today and tomorrow. Thanks again for joining us. So we're just going to go through some of the final questions that have come through. Thanks for those who've participated in this. Really good to get your feedback, and also a lot of sharing of information on the Facebook page there as well. So thanks for sharing your tips and hints and doing that throughout the course as well. That's been fantastic. Just to recap on some of the stuff that's there. Ellie, you'd asked about the physical exercise. I was just reminding myself of what's in the course tomorrow, and in fact we do go through in a lot of detail tomorrow about physical activity, about insulin adjustment, about different intensities of exercise and how to adjust your insulin. So that will all be there, including tables that you can download and things. So if you've got any problems with that, I can send you those separately, but otherwise that is all coming up tomorrow, so hopefully you'll find that useful. And it talks about as well, we've got some really good examples from people who do some quite extreme sports with type 1 diabetes. So we've met some amazing people on our journeys, including people who've climbed Everest and people who've done sort of multiple marathons over over several days in a row, and who've managed their type 1 diabetes through that. So they've shared their sort of hints and tips as well. So one of the videos coming up tomorrow contains some of that information with some of these participants. So hopefully you'll find that useful. Other things that I've shared was around the Night Owl, or the Night Scout project as it's known, the sort of We Are Not Waiting project, which is about the DIY closed loop systems. So it sounds like some of you from the chat are already familiar with this, maybe already doing it yourself. For those of you who want to know more about that, I've just put a link there to their website, and they basically talk about how they've managed to basically connect up blood glucose monitoring systems to insulin pump systems with algorithms and rules that allow that continuous feedback loop to happen, so that the insulin pump will basically auto adjust according to your blood glucose levels. It doesn't completely take the work out of it. I think it's still important if you can kind of preempt meal times and exercise times with sort of forewarning, but essentially the system will autocorrect, and I think that is the way things are going in the future. As we develop more and more sophisticated systems around this technology, then we will very soon, I think, have a plug and play system that works really well for autocorrecting insulin doses. But whilst we're not there yet, we need to do a bit of hard work still around the insulin adjustments. So I think that's a lot of what we've been talking about today. If there's anyone out there who isn't registered on the course, please do still sign up. The course is running today and tomorrow, but even if you join now, you'll still be able to access all the content from both today's course and tomorrow, and we will leave the course running for a few days afterwards for those who haven't quite managed to complete it. So please still sign up at Understanding Type 1.mydiabetes.com. The address is there. And also, as mentioned, there are a number of websites that you can go to for follow-up information and courses, including the NHS England mytype1diabetes.nhs.uk website, and the Scotland My Diabetes My Way website, and the regional websites as well. So they're all in the Facebook chat, so please use those for any sort of ongoing support that you need. So that was the main information there about exercise. Just to touch on as well what is coming up tomorrow, so that you're familiar with that. We've got talking about complications of diabetes. So we'll be talking both about sort of short-term and long-term complications of diabetes, particularly thinking about diabetes' potential effects on the eyes, kidney, feet. We'll be talking a little bit about diabetes and sex. We'll be talking about heart complications, but more in the context of how you can really significantly reduce your risk of these complications happening. And part of that's about glucose levels, but it's also about thinking about other things like blood pressure, cholesterol, and diet, smoking, other things that are risk factors for these complications. So we'll be giving you lots of info on that. And then in our Living with Type 1 Diabetes section, we talk about healthy eating, we talk about physical activity in more detail, and about insulin adjustment in accordance to physical activity. Alcohol, which is really important, because not only can alcohol put you at risk of hypoglycemia, low blood sugar levels, as you'll find out tomorrow, because of effects on some of the enzymes in the liver that manipulate glucose excursion from the liver, but depending on what you're drinking, there may also be carb in alcohol, so it can be quite difficult to balance insulin levels when you're drinking. So we will talk more about that tomorrow. We also talk about smoking and mental well-being, and we've touched on this a little bit today. And what was really lovely coming through today was all your stories about when you were diagnosed with diabetes or a family member was diagnosed with diabetes, and your experience of living with it. I mean, I think everyone really benefited from sharing those stories. And I think tomorrow when we touch on well-being, mental well-being, it's something that isn't discussed enough, I think, in relation to type 1 diabetes, but it's a really important part. We know people with diabetes are at between 2 and 4-fold risk of mental health complications compared with the general population, yet it's something we don't talk about enough. So we'll be talking there about sort of anxiety, depression, diabetes distress, which are all important aspects. We'll also be talking about coping with illness. So we talked a little bit today about sick day rules. So that is actually all coming tomorrow. And that is about what to do when you get ill, which at the moment, I guess it's on everyone's mind with COVID and that time of year really when the flu's around and people are more susceptible to bugs and infections. What to do to manage your diabetes well when you're when you're sick. And we'll talk there about ketone monitoring, doing that a little bit more regularly, but also about what to do, how to adjust your insulin effectively at home if your blood sugar levels are starting to creep up and your insulin requirements are starting to increase in the context of illness. We'll also talk about travel, because I think once we're allowed to travel again, if that ever happens, then actually adjusting insulin over different time zones can be hard. But there's also other things to think about when you're traveling with diabetes, like storing insulin. What if you're using an insulin pump? What if you're using a Libra? Does that have any issues for security? What can you take on the plane? What should you put in the hold? What shouldn't you put in the hold? All these sorts of practical things about what to do with your kit when you're traveling, we'll touch on tomorrow. And then driving as well, because there are some very specific regulations most of you will be aware of in relation to driving if you've got type 1 diabetes, and we'll talk about that and the requirements for that. So lots to cover tomorrow. I think it's going to be a really interesting day, really busy. Can I encourage you please to share the course? So if you are doing the course and you're enjoying it, please share it with other people, and hopefully we'll get more people joining the course. The more there are, the more interesting the discussions are, the more stories to be shared. So please encourage the sharing of the link, get people onto the platform, and we'll be following up with you as well after the course. And as I say, there are lots of other resources out there, so if this has given you a taster but you want more information, we will continue to point you in the direction of additional resources to help you manage your diabetes more effectively. So thanks everyone for joining us tonight and spending the time with us. Hopefully that's been useful. Thanks for joining us on the course. Look forward to seeing you tomorrow. Thanks to all the team who are out there, Kirsten, David, Alex, Scott, Lynn, Salma, Nader, and anyone else. Apologies that I've forgotten to mention, but thanks for all your input on tonight's stuff and on creating the courses. And hopefully it's been a useful resource for you all. So we'll sign off for tonight and see you tomorrow. Thanks.